different narratives in terms of whether we need to worry about this or not. Mm-hmm. A lot of the people who are testing positive, of course, are not sick. And this is an incredibly important message to get through. What we have right now is a very high number of positive PCR tests, but the hospitalization rate actually is fairly flat, as is our ICU rate. And again, it's what the expectations are. And so I think for the province, one of the things we need to start reporting really accurately is whether or not people are being admitted because of COVID or just with a positive test, because of course everybody gets screened. Anybody with screen positive is reported as an admission. And we also have to be very realistic. It's never going to be zero. It's respiratory tract season. And so for me, it's always been that balanced approach. I'm actually a lot less worried about cases in the community who are not actually unwell, and saying we've actually achieved what we needed to achieve in terms of dramatically reducing the risk of severe disease and hospitalization. And it's for me time to pivot from testing every asymptomatic person in the community, which isn't really leading to very much. We've got a very vaccinated population. We've got a high degree of protection against severe disease, and shift entirely to focusing on how many patients are being admitted to hospital because they are sick with COVID. And that's a very different number. And if you look at that, it's also a much less alarming number.
Okay, so I did want to make it very clear, though, in terms of what you're saying and seeing that in terms of the positive cases, people aren't as sick as they were perhaps with Delta. This is due to vaccinations. Is that correct?
Well, I mean, if we look internationally, this strain Omicron is significantly, everything we're seeing from every other jurisdiction is less severe than the others. And there are a variety of reasons why this may be. But what we're clearly seeing, countries with high vaccination rates, countries with low vaccination rates, that it's simply not as severe. It is much more of, well, you've seen the headlines saying, how do you know if you've got a cold or if you've got Omicron? The fact that you're even asking that question, whether you've got a cold or an Omicron, tells us that it's pretty mild. And so for the vulnerable adults who are always at risk of severe disease, I think the vaccinations have made a dramatic difference in reducing the risk of being hospitalized. And that is a very important message all along. The single most important and powerful thing that the vaccines have provided is that reduction of severe disease and hospitalization and the risk of dying from COVID. And this, again, is an important message because I don't think some of us... I mean, vaccines don't make a virus go away. They stop severe disease. And I think that's the message and the balance that we have to try to achieve in our communication.
So then how much more important now are booster shots then?
I think I was very happy with the NACI recommendations, the National Advisory Committee on Immunizations, that the group that is going to benefit by far and away the most from a booster are those who are vulnerable already. So our seniors, people in congregate care settings, people with a lot of comorbidities, that group for sure is going to benefit. And the additional benefit from a booster for low-risk people, that's probably an individual decision on how risk-averse a person is. We've certainly made them available for anybody who would like to have a booster.
I did want to ask you, though, about children because they cannot be vaccinated under the age of 5. What can parents do to make sure that they stay safe, whether they're at home or at daycare? Because we have seen that they are able to transmit the virus and that we are still not sure, from my understanding from the experts we've been speaking to, whether or not somebody might have a more severe case of Omicron.
So nowhere in the world, including Canada, this is one of the good news stories of the COVID, is that children themselves are very unlikely to have severe disease. And interestingly, they're actually less likely to transmit it. And there's a lot of hypotheses for that. Not that it will never happen. And so honestly, the advice is the advice that we were given all along. If a person is unwell, they have symptoms, that person should stay home. And that person should stay away from small children. If a person is a high-risk adult, and by high risk I mean at high risk of severe disease, and that again is our vulnerable seniors, people with a significant well-known comorbidities, that person maybe wants to take more precautions of where they go out and about. But again, it's that balance of how do we ameliorate the risk of COVID to our high-risk population with actually everything else that we need to get on with and do as a society, because it's not COVID versus nothing. It's COVID versus health and well-being in every other aspect of our physical health, our mental health, our social health. And that's the balance I think we're all trying to struggle to find at the moment. And I for kids, we can't keep